In the United States alone, there are reports of around 16,000 new cases of lupus each year, and up to 1.5 million people may be living with the condition, according to the Lupus Foundation of America. Due to its complex nature, people sometimes call lupus the disease of 1,000 faces. The foundation says that lupus affects women in particular, and it is most likely to appear between the ages of 15 and 44 years. Lupus gained public attention around 2015 after the singer Selena Gomez announced she received a diagnosis in her late teens and underwent treatment for the condition. So, what is lupus? Lupus is a long-term autoimmune disease in which the body's immune system becomes hyperactive and attacks normal, healthy tissue. Symptoms include inflammation, swelling, and damage to the joints, skin, kidneys, blood, heart, and lungs. In other words, is a chronic disease that can cause inflammation and pain in any part of your body. It's an autoimmune disease, which means that your immune system, the body system that usually fights infections, attacks healthy tissue instead. Lupus most commonly affects your skin, joints, internal organs, like your kidneys and heart. So, what the different types of lupus? There are different kinds of lupus. This article will focus mainly on systemic lupus erythematosus, but other types also include discoid, drug-induced, and neonatal lupus. The first type is the systemic lupus erythematosus. This is the most familiar type of lupus. It is a systemic condition. This means it has an impact throughout the body. The symptoms can range from mild to severe. It is more severe than other types of lupus, such as discoid lupus, because it can affect any of the body's organs or organ systems. It can cause inflammation in the skin, joints, lungs, kidneys, blood, heart, or a combination of these. The second type is the discoid lupus erythematosus, also called cutaneous lupus. This one affects only the skin. A rash appears on the face, neck, and scalp. The raised areas may become thick and scaly, and scarring may result. The rash may last from a number of days to several years and may recur. The third type is drug-induced lupus. For this one, the symptoms occur because of a reaction to certain prescription drugs. According to Genetics Home Reference, some 80 drugs may cause the condition. That's a whole lot. These include some of the drugs that people use to treat seizures and high blood pressure. They also include some thyroid medications, antibiotics, antifungals, and oral contraceptive pills. The last type is neonatal lupus. This happens to some babies born to mothers with systemic lupus erythematosus. However, around 1% of women with autoantibodies relating to lupus will have a baby with neonatal lupus. At birth, babies with neonatal lupus may have a skin rash, liver problems, and low blood counts. Around 10% of them will have anemia. The lesions do usually go away after a few weeks. However, some infants have a congenital heart block, in which the heart cannot regulate a normal and rhythmic pumping action. The infant may need a pacemaker. This can be a life-threatening condition. What actually are the causes of lupus? Well, lupus is an autoimmune condition, and the exact cause is unclear. Remember that the immune system protects the body and fights off antigens, such as viruses, bacteria, and germs. It does this by producing proteins called antibodies. White blood cells, or B lymphocytes, produce these antibodies. So, when a person has an autoimmune condition, such as lupus, the immune system cannot differentiate between unwanted substances, or antigens, and healthy tissue. As a result, the immune system directs antibodies against both the healthy tissue and the antigens. This causes swelling, pain, and tissue damage. These autoantibodies circulate in the blood, but some of the body's cells have walls permeable enough to let some autoantibodies through. The autoantibodies can then attack the DNA in the nucleus of these cells. This is why lupus affects some organs and not others. Lupus may develop in response to a number of factors. Number 1. Hormones. Hormones are chemical substances that the body produces. They control and regulate the activity of certain cells or organs. The risk factors associated with hormones include sex and age. The U.S. National Institutes of Health note that females are 9 times more likely to have lupus than males. Some symptoms and diagnosis often occur between the ages of 15 and 45 years, during the childbearing years. However, 20% of cases appear after the age of 50 years, according to Genetics Home Reference. As 9 out of 10 occurrences of lupus affect females, researchers have looked at a possible link between estrogen and lupus. Both men and women produce estrogen, but women produce more. Number 2. Genetic factors. Researchers have not proved that any specific genetic factor causes lupus, although it is more common in some families. The risk factors associated with genetics are race and family history. People of any background can develop lupus, but it is 2 to 3 times more common in people of color compared with the white population. It is also more common in Hispanic, Asian, and Native American women. Furthermore, a person who has a first or second degree relative with lupus will have a higher risk of developing it. Last factor, your environment. Environmental agents such as chemicals or viruses may also contribute to triggering lupus in people who are already genetically susceptible. A number of environmental triggers include smoking, precisely higher tobacco exposure to sunlight, medication, and viral infections. What are the symptoms of lupus? How do you know if you have it? Lupus has a wide range of symptoms, including pain or swelling in joints and muscles, swelling in the legs or around the eyes, fatigue, a loss of appetite and weight loss, swollen glands, skin rashes, due to bleeding under the skin, mouth ulcers, unusual hair loss, pale or purple fingers or toes from cold or stress, arthritis, sensitivity to the sun, fever, headaches, chest pain upon deep breathing. So, which parts of the body does lupus affect? It is important for you to know that lupus can affect the following systems: the lungs, which causes chest pain, particularly with breathing. Also, pneumonia may develop your blood and can cause anemia or leukopenia your central nervous system, which also affects the brain. Blood vessels, vasculitis, or inflammation of the blood vessels can occur. This can affect circulation in the kidneys, which can make it difficult for the body to remove waste products and other toxins effectively. And finally, your heart. Are there treatments for lupus? Unfortunately, no. However, people are living longer and better with lupus than ever before. Although there's no cure for lupus, there are treatments and lifestyle changes that can help you manage your symptoms. Treatment for lupus depends on your symptoms and how severe they are. Treatment can help ease your symptoms, bring down inflammation, prevent and relieve flares, prevent organ damage and other health problems. To ease the symptoms, doctors can advise you to use anti-inflammatory drugs, anti-malarial drugs, or corticosteroids. Here's what you need to know about anti-inflammatory drugs. If you have lupus, you may have joint pain and swelling, especially in your fingers, wrists, or knees. Sometimes you may have a fever. Non-steroidal anti-inflammatory drugs, such as ibuprofen or naproxen, can usually help you ease both of those problems. You can buy them without a prescription. Sometimes they can irritate your stomach, so take them with food or milk. Here's what you need to know about anti-malarial drugs. Some medications used to treat malaria can also treat lupus. They are used to treat skin rashes, mouth sores, and joint pain. They may also reduce your risk of blood clots, which is a concern in some people with lupus. Anti-malarial drugs protect against skin damage from ultraviolet rays in sunlight and may protect your body against organ damage linked to lupus. Side effects like stomach upset tend to be rare and mild. Here's what you need to know about corticosteroids. Lupus makes parts of your immune system overactive, so it attacks healthy tissue by mistake. Corticosteroids weaken this immune response. Your doctor may prescribe them if lupus causes problems in your heart, lungs, kidneys, brain, or blood vessels. Taken as a pill or IV, corticosteroids work fast to ease the swelling, warmth, and soreness in joints caused by inflammation. They can also prevent long-term organ damage. However, you have to be careful about it as there are serious side effects. Corticosteroids can have serious side effects like greater chance of infections, fragile bones or bone damage, muscle weakness, diabetes, and cataracts. You may also have weight gain, bloating, and mood changes from taking them. Apart from the medication mentioned, you can use the following to relieve pain or reduce the risk of a flare. Apply heat and cold. Participate in relaxation or meditation activities, including yoga. Do regular exercise when possible. Avoid exposure to the sun. Avoid stress or stressful environments. It's important to note that lupus is not a contagious disease. A person cannot transmit it sexually or in any other way to another person. As always, we recommend you to consult with your doctor to find out about potential treatments and what is appropriate for your body. Thank you for listening. In this channel, we cover all health issues and questions and solutions you often ask yourself but rarely find the right answer to. Our goal is to empower the healthy version of you.